Welcome to the 2024 Sizzling Summer Series, sponsored by the University of Nebraska Medical Center College of Public Health, Office of Public Health Practice, in partnership with the Midwest Public Health Training Center. My name is Brandon Drews. I'm the Workforce Development and Leadership Program Manager at the University of Nebraska Medical Center. My colleague Julia Quigley and I will be your hosts for this series. Our sixth annual Sizzling Summer Series continues from last year's focus on exploring how to make data come alive. Now, more than ever, we are called to clearly communicate the invaluable impact of our field through data visualization. Over the months of June, July, and August, we'll be hosting a three-part series from experts as we learn how to build, stretch, and refine our skills to communicate the value of public health through data visualization. Today marks our second session with an insightful presentation by Dr. Bill Brantley on how to use data visualization to enhance your credibility, logic, and emotional appeal. Dr. Bill Brantley is the President and Chief Learning Officer of Brantley Advanced Social Science Applications. He is a certified project manager, management professional, an agile project manager, an accredited business analyst professional, and is certified in discipline agile project management. Dr. Brantley is also a certified professional in talent development, a certified professional in training management, and a certified data scientist. Dr. Brantley is an adjunct faculty member for the University of Louisville for 24 years and the University of Maryland for 13. He has created 12 online courses in project management communication, digital transformation, and no-code development with a global audience of over 20,000 students. He is the author of The Persuasive Project Manager, 4 Scenarios for the Future of the Federal Government, and Strategic Career Reinvention. Today, he'll use his expertise to help us in using data visualization to more effectively persuade our audience using credibility, logic, and emotional appeal. Thank you, Bill, for joining us today. We have just a few housekeeping items before we turn it over to Bill. For today's webinar, all participants will remain muted. However, we do encourage questions and dialogue in the chat box. There will be time for participants' Q&A at the end of the webinar. My colleague and I will monitor the chat to ensure our speaker hears the questions today. Today's session is being recorded, and the recording and slides will be available on our website. We also invite you to evaluate your experience via a short survey. The link to the survey will be emailed out after the webinar. At this time, we turn it over to Bill.
Okay, thank you so much. And it's great to meet everyone, and looking forward to the next hour and getting to know you folks. And I also got the chat window open, so if you have some questions or whatever, and I can answer them during my presentation, I'll certainly be glad to do that. And I hope I've left plenty of time for us at the end for our questions. So again, you kind of met my background here. And one thing also is I have, when for preparation for the speech, been in federal government for 13 years, have a good friend of mine that works at the Center for Disease Control, who is a public administration officer, ran this presentation past him and kind of got some nice little pointers there on what specific issues confront you folks in public health and communicating with folks. So I'm going to give you a little bit of here, some tools, and hopefully some stuff that you can use into your toolkit to help you communicate better. So the first part here, I want to talk about what persuades people. And I highly recommend this book. It's actually a comic book now also, so you can get a comic book version of this. And I say that because I teach undergraduates, and they seem to enjoy the comic book more than the actual text. Still the same information. But anyway, this is a excellent book about influence in the 6 principles. He's added a 7th principle recently in the last couple of years, which is more kind of like a community and how we kind of work with our community. But these 6 principles of influence kind of help us work with being persuasive. And of course, with you folks, you probably start with authority. You know, you have the background, you have the training, you know all about public health, and that gives you a good platform to work from when influencing people. Then there's the social proof idea. Everyone else is doing it this way. We should do it this way too. Commitment and consistency. Kind of a fascinating principle of influence here, where you get a person to kind of commit to things. And when I was talking to my friend Brad about this, what he said, and you all remember the early days of the pandemic and the quarantine, and he was assigned on the simple message of getting people to wash their hands for 20 seconds or more. So it's kind of like the commitment and consistency piece here of trying to find a good song, but also the idea, kind of coming back to that 7th idea of community, how you protect others, especially people in your friends and family. Liking, we have to like the people that we hear from and such. Scarcity, you've all seen scarcity in action, right? If you've been on Facebook, if you've been on Amazon and they're trying to sell you something, hurry now. Only 2 spots left or only 3 books left, right? Just saw it this morning when I was shopping on Amazon. And reciprocity. This was a fascinating area of influence here. I don't know if you guys do it as much in your field of work, but things like they did experiments with waiters where waiters would come up and offer some, a piece of chocolate or something, and then people would want to reciprocate and they would maybe make the tip bigger or something like that. So it's fascinating here. And all these are science-based, lots of research behind them. And that's where I like to start off when I do the persuasion. And I like to make sure that I can at least get 2 or 3 of the principles in there. Don't try for all 6 because you're going to overload the message. I've found that out before. You're going to overload the message and it's going to be confusing. 2 or 3 are just enough to get by. And then, of course, we're all familiar with Maslow's hierarchy of needs. And as you folks work in public health, of course, there's the physiological needs and the safety needs. That's probably where you resonate a lot of, and that makes a lot more sense to people and makes it more authoritative. But as you get up there, sometimes you have to talk about the social relationship needs. So I've been watching on, the local channel here. I'm in College Park, Maryland, which is just outside of D.C. And I know the D.C. Public Health Department's been doing a big campaign on getting tested, getting vaccines, and the idea of, not just for yourself, but for your family. So kind of reaching that social need. And then there's esteem needs and self-actualization, which with public health, not sure if that comes into play with a lot of that. If it does, please tell me about that in the chat. But that's how we kind of go down through this, and we're working with the persuasion. So a lot of things I say about persuasion, if you don't get anything else from this, you get this. It's all about knowing your audience, knowing what motivates them. And I love this one. This is from something called neuromarketing. You all have probably encountered neuromarketing on Facebook or on Amazon or anywhere on, the internet, because a lot of these ideas are here. The idea of nudge. Okay, so we need to get an attention. We need to get your attention there. So if you can imagine, you're at the top of the slide here, like the playground slide, you get a little nudge to get you going. And then the gravity, that's kind of your internal motivation, and you want to tap into that. So when you're creating your public health message and you're using data for that, think about how the data taps into the customer's internal motivation or the citizen's internal motivation. Why would they want to do this? Why would it be a good thing for them? And if it's something that they really want to be motivated by, like our family or self-esteem needs, that helps it get going further. The angle is your motivation, which is, as the angle is steeper, faster for you to go down. And the friction is, of course, the difficulties faced by the customers. That's why we always talk about friction-free. So I'm pulling all this together for you to kind of think about what does persuade people. And a lot of times it's tapping into their motivational drives and looking at the Maslow hierarchy of needs and how far you can get up that pyramid. Now, the base pyramid makes a lot of sense. At the bottom of the pyramid, a lot easier to motivate people on that with safety needs and such. So you got that advantage. But as you go a little bit higher, these needs, once their base needs are met, the higher needs can be met then, but it takes a little bit more persuasion. So that's kind of the quick way about doing persuasion, although I've taught some, semester-long courses on persuasion, but you can kind of boil it down to that. All right, so any questions so far? Anything in the chat? Hoping it's tracking okay. And if you're hearing me all right, give me a Y. And if you had some questions, you can throw them in now or give me an N, and you put that in the chat. So just want to make sure we're all tracking okay. Okay. Yes, good. So I see a yes or Y. Yeah, perfect. Thank you. So now we know what's going to persuade people. We're going to talk about presence, logic, and emotions. And this is a classic theory. This is from Aristotle. This is over 2,000 years old, still holds true today. There is a wonderful book called 5 Stars. I think it's written by a guy named Gallo, Gallo, and talks about how people use this nowadays. And even with modern digital communication, it still talks about ethos, logos, and pathos. For fun, if you ever watch some of those infomercials, or I tell my students those beer commercials, you can see the rhetorical triad here at play. Our ethos, or what is our presence, our credibility. That's why we have so many people saying, I'm not a doctor, but I play one on television, giving you that kind of, that authority piece. Logos, the logical statements you make, and pathos, the emotions that you can evoke in your audience, all right? And you really need this in kind of a balanced blend here. because you can have incredible presence, but if you don't really have any logical arguments and you don't have really any emotion back here, it loses its credibility. Your message loses its credibility. If it's all logic, it may be persuasive, but people may forget it soon. And with pathos or emotions, one thing about people is that we are emotional people and we put a lot of weight on emotional meanings. Even if you have a great logical statement here, the emotions help you remember that and put that into your long-term memory. And I'll talk about a little bit that later. So getting a good balance here helps you with making your message more persuasive. And I know we're going to be talking about data here soon, but I just want to kind of go through this piece here and have you set the stage. So with logos, essentially it's the logic here. And I can take my speech and I can tree it out like this and show you all how things are connected. So when we make logical statements, we're showing the how, the why, how things are connected. One thing about people, we love stories, and we'll talk a little bit about stories and how to use stories and why stories are so effective. They help us make sense of our world. There's cause and effect. So I can put things together through a story and make cause and effect, and you guys can even ride along with me as I'm telling the story. How many times have you been caught up in a movie? You've watched a movie and you're just like so entranced by it, you feel like it's happening to you. That's how it works with us. And we actually have structures in our brain, mirror neurons, that we can follow along with people and imagine ourselves in the same state, okay? So we have the logos. Next is the pathos. And the reason the pathos is so important is because that's emotion. And emotion tells us what's important. They've done studies with people that have lost the amygdala, that's the emotional center of their brain. And these folks can reason well, they can function well, they can understand things well. But if you sit them inside, if you sit them down in a restaurant and you hand them a menu, they can't make decisions. Everything looks the same to them. There's nothing really motivating them. So they can make good logical statements and they can analyze the menu, but they really don't have the drive to pick something. And that's where emotions come in. It tells us what's important and how it works for us. And also emotions tell us what we should remember. So even if you have a data presentation and it's very, statistics and all this stuff, and it seems kind of dry, you can put some emotion into it by talking about the challenge you're trying to reach and why it's important for folks. So a lot of times when you're doing the public health messages, you want to have, of course you have your statistical evidence and you have the reasoning and the logic and the data for you, but you want to have a little bit of emotion in there on what is the challenge we're trying to confront and how do we overcome it. And by putting that emotional marker in, this is exactly what your brain does. There's the hippocampus, works with the amygdala. The hippocampus puts an emotional tag on some of your memories, and that's why it goes into long-term memory. All right. And then we have ethos. And just like at the top of the hour, I was in the great introduction. Thank you so much. You talked about my credentials. I hope you can see the passion for the topic I have and the common ground that I'm trying to reach with you folks on why this is important and kind of pulling in experiences and what I've learned about public health to help you understand how this works together. Okay. So is this making sense so far? Give me a why if it is. Give me an in if you need me to explain some more, but is this making some sense here? Okay. And I know we'll get to the fun stuff too, because I love statistics also, and I love data. So we'll get to that too, but I want to set the foundation for you. Now, how does data enhance persuasion? And I'll tell you a little story here, because I worked at the Patent and Trademark Office. I worked in the enterprise training division, and I spent a lot of time training folks on communication. And we had an incredibly brilliant workforce, a lot of PhDs, attorneys, really highly trained people. We probably had the most highly educated workforce outside of NASA at the Patent and Trademark Office. And these folks were amazingly brilliant people. And I mean, they would examine patent applications and all kinds of things. Pacemakers and nozzles, and I mean, all kinds of different things that make our technological world go around. And one of the things I had to train folks is they had lots and lots of data. And when I had my first class, I would ask them to do, some of the students to do a sample and demonstration for me. And they would go up there and put up something like this. They would put a spreadsheet up on the screen and say, okay, here's my data. And as you can see here, and I just want to ask real quick, what is this data about? What's going on here? Does anyone see a message in this data? Right? And I'm betting not, because, what's this agency? Well, you can kind of figure that out. Level, D6, that's demographics. So you can kind of see some demographics. Yeah, no. Exactly. Question one, question two. But the folks would come up there and do this. And what I taught them to do is you need to bring the data into kind of a story-like format and add the ethos, pathos, and logos to it, and think about what you're trying to persuade the audience to do. Now, there are clearly informative speeches, and informative speeches are fine. And, we're not trying to persuade people. We're just trying to brief people. And this can work for that. But in the cases that you probably work in, and what my friend Brad was telling me, is a lot of times with public health, you're trying to persuade the audience to do something. You're trying to, practice good dental habits, or to, like he said, teach them how to wash their hands, or to cover their mouths with masks, in public and such. So these are kind of different persuasive arguments you need to make. And you can give people all day long, you can give them all kinds of data. But you have to make the data relate to them, and you have to make the data fit together and explain to people why it's important. I know we ran into a lot of folks during the quarantine that, there was all kinds of evidence about masks and why we need to use those, and why we need to help, limit the spread of the COVID virus, and great logical arguments, but you still had people that just weren't emotionally queuing into it and were very, very adamant that they were not going to wear a mask. So what you're trying to do here with this data is that, of course, you have data. You want to turn it into information. And the information answers who, what, where, and when. And, the raw data is, you need that, of course, to put things into context and, of course, answer those other questions for you. But data needs to go up to the information stage, and then to the knowledge, where we answer why and how, and then the wisdom. And sometimes you can go with just the data, information, and knowledge to the wisdom of doing things. But it does take that kind of that chain. And if you think about your data in that way, and your data analysis in that way, and how you're running up the chain, and basically with information answering who, what, where, and when, setting context for your folks, and then giving them the knowledge behind that data information, why and how we should do things, you'll be more persuasive and can tune in more to what people need. Is this making sense so far? Give me a why if it is, give me an N if it isn't. And get used to me, because I do this all the time in these presentations. Why? Okay, perfect, great. And I'm certain I'm certain many of you have encountered, public health challenges in trying to persuade folks to do something that seems pretty common sense, but they just don't want to. And you may have the data behind it, but you have to think about, did I take that data? Did I turn it into information, into knowledge, into wisdom? And that's one way of getting through this. So give you a little bit about storytelling here, and storytelling can help you build into the data analysis really well. So one thing about storytelling is that conflict is the heart of stories. And I'm trying to remember the gentleman's name right offhand. Sorry, I forgot that. But he created something called the ABT framework. And, but, therefore. And this gentleman was fascinating because he was a marine biologist, and then he decided to take a career change, go out to Hollywood, and become a screenwriter. Not sure what that was, but he does screenwriting for different science documentaries. And he had studied stories, and he found that this and, but, therefore is pretty prevalent in all stories out there. And he calls it the narrative continuum. So you can have and at one end of the continuum. And if you've had small children tell you stories, it's all and, right? Like, then I took my cat, and then we went to the ice cream store, and then we got chocolate, and then he ran away, and then it's just and, one statement after another, right? And it's not just kids that do this. My patent examiners, when they were up there presenting, or when I was training folks at the Office of Personnel Management, my human resource people, they forgot, when they tried to tell a story, it was just a collection of and statements. And I'm realizing the pun of doing that, and it wasn't that interesting. Okay, so that was one end of the narrative continuum. Then you have what I would like to say with some of my colleagues in academia, despite, however, yet, DHY. Despite, however, yet, we're going off in all kinds of tangents. So it's not really narrative anyway. There's a lot of action going on. There's a lot of stuff happening, but it's a lot of unrelated tangents that look like a story, but there's no real conflict because we're going from one thing to another. And you may have seen that with some academic lectures. I know I have. So right in the middle here, the sweet spot is the and, but, and therefore. So we set the context, okay? So in public health here, again, I'm going to use the quarantine. We have the COVID virus, and it is spreading through transmittal, through the air transmittal. But we can stop those increasing rates by using masks, Therefore, we should work on a campaign to have people wear more masks. All right. So pretty simple there. So we set the context and then we talk about, okay, but the conflict here is that we can stop that problem with masks and therefore we can resolve the solution, therefore we can move on to a new future. So if you think about it this way, I like to use the old gap analysis. Here's where we are right now. Here's where we want to be. And the but here is how we can get to that, how we can continue on. So laying a lot of work and foundation for you. Now we're going to get into the fun of taking your data. So while we're going through this, think about a data set you have now. Think about a data set you're working with. And think about some of the challenges you have in communicating or persuading people using that data set. And I'm going to teach you something, and this is a tool. And if you don't get anything out of this presentation other than this tool, I'll be very happy. And this is the CCARI, and it stands for Context, Challenge, Actions, Results, and Impacts. And that's taking the ABT story and kind of spreading it out more. And I've taught the CCARI method for over 10 years now and in all kinds of places. So this works really well. This works with formal presentations. This presentation itself was done as a CCARI. This works well if you're on the phone and your boss calls you up and I have an index card, and I know I'm so analog, an index card, and I'll just sketch out the CCARI there and talk about what I want to talk about, done in hallway conversations. And what it does is it puts your ideas and what you want to do into a story format that your audience can readily follow and come with you on what you're trying to persuade them about. So when we do their data, one of the things we want to do is we want to set the context. So when you have your data there, what, who, when, and where, what is this data telling us? Where did you collect it from? What did you collect? What are you trying to say with this data? What is it that you notice in the data? So it's what, who, when, and where, okay? So you're setting the context. Now, you don't have to spend a lot of time on context. You just want to get enough so the audience understands where you're coming from. So if you've ever watched movies out there, sometimes movies will just give like the opening scene will just be like, let's say, Africa, 1977, something like that. Just like, here's the date, here's the place, and then we go right into the story. Sometimes you may need to go a little bit more into the context to get your audience on the same page with you. And it's part of your audience analysis, like how much do they know about this subject? How much do they need to know to make sense of what I'm talking about? Okay. Now, once we've got the context set, we can go into the challenge. So one of the things, and I want to thank Brandon for this, he sent me some graphs and some charts and some interesting stuff here. And one thing I keyed in on was the idea of provider availability on community health. In other words, how many doctors and dentists and primary nurses do we have in an area, and how does it affect our community health? So, of course, the idea here is, pretty simple, I think, kind of a linear relationship. That's what I see at first. The more doctors we have in a community, the better the health would be, right? So that may be the challenge. Maybe we want to take a look and see, do we have something to prove that? Is there some other confounding factors? What is the challenge here? In other words, what do we do when we're in areas that don't have enough doctors and nurses? So I come from Kentucky. That's where I originally was born, Louisville, Kentucky. And I know, a lot about the rural areas there. And one of the crises that they're facing in Eastern Kentucky is just not enough hospitals and doctors and nurses and dentists near the people. And, you may have heard about these health deserts. I don't know if that's a term that's come to you guys, but I know in Kentucky, we talk about health deserts and how far people have to travel, and sometimes they can't, to get to good health. So that's our challenge here, the idea of provider availability, in this case here with that story. And what is the action? Well, when we're doing data, it's very simple. We prepare the data and we crunch the data. And that way we can come up with a set of recommendations. So we take a look at, if we're in an area that doesn't have enough doctors and nurses, what can we do? What is the action we want to take? So one solution might be very affordable transportation to hospitals, maybe having visiting nurses, increase our visiting nurse association programs, stuff like that. Good friend of mine from high school, that's what she does nowadays. She's a visiting nurse in Eastern Kentucky. And that's what, and she's seen her practice actually increase because of these health deserts. So once you get through the context and the challenge and the action, we're going to look at results and impacts. And the results we, of course, do with data visualizations. And I'm going to take a quick detour in a little bit here and tell you about some good data visualizations. We'll actually have a chance to critique one. And what is the answer to the question or argument? So in our case here, we look at this challenge. The idea of health deserts, the availability of availability of healthcare workers like doctors and nurses and dentists. And what have we noticed in our data? That we may have one community that has few providers, and another community has about the similar number of providers, but they seem to have better health outcomes. So what is that, and what is going on in that community that makes that work better? And then this is where we take our data. So we've taken it through we have our raw data, we've created information, and we're creating knowledge. So this is part of here is when we get to the results, we're looking at the knowledge here. And then what is the impact? What's the long-term impact? What can we do with that knowledge and turn it into wisdom? So we can say our solution was to increase the visiting nurse program. We see the results. When we do that, we get this really nice bump in public health. It gets better. And what's the wisdom here? Maybe thinking about ways to build out those programs, make it easier for communities to build out those programs, and the value of visiting nurses to public health. And then this is where you get into it, because we're doing a persuasion. We want people to do something. We want to call to action. We say, what actions do you want the stakeholders or organizations to take in response to what we just presented to them? Do you want them to give more funding for visiting nurses? Do you want to talk to the medical schools about increasing visiting nurse programs, maybe doing an internship, something like that? But the idea here is to bring them through this CCARI process, this story building process, using the persuasive foundation I gave you, and compelling people to go to that decision. Okay. How's this making sense so far? Is this making good sense? Give me a Y if it is, give me an N if it isn't, or if you need some more explanation. Okay, good, good, good. So one of the things I do when I work with visualization, even before I get into the data, and I'll be very frank with you. I have some friends of mine that are data scientists, and they tell me I should be doing this, but I think it's a good thing because they say, well, you got a goal in mind, so you may want to color the data that way or shade it the way you want, so you get the goal that you want, and how you know you're going to be objective. That's a great question. One thing I do, and I learned this from my dissertation studies, is it's a term in phenomenology. It's a kind of methodology used to analyze stuff, and it's called bracketing. So sometimes when I'm working with data, I'll have an idea of what I think I should see. Okay, I'll have an idea of what I think the conclusions are, and I'll write those down. And that's called bracketing. And I just put it down there, and I have it out, and I kind of think about this. Okay, and I have my statements, and then I approach the data analysis without going with that goal. But I have my goal written down, but I try to approach it without the goal in mind, and then go back and look at my bracketing and make sure that, did I anticipate this? If I did I shade the data that way? I try to check myself, okay? And I got that idea actually from Darwin when he was working on his theory of evolution. And one of the things he did, this is one reason why it took him so long to publish the theory, because he had the theory in his mind for years. But it took him a while to publish it because he was also looking for counterfactuals. He's looking for ways to dispute what he's thinking of, and looking for ways to poke holes into his theory, because he wanted to make really sure that he, was really what he had discovered and what he was thinking about and what he had put together was as truthful as he can get it, and that it was valid. Okay. So again, with design with the goal in mind, you want to keep that in your mind, because I know there's some results we want, but sometimes the results you get are much better. I remember when I did my dissertation, it was all about change management in public agencies. And I had one idea how it's supposed to work. And then when I did the research, I'm like, oh, this is totally different from what I've seen. I've never seen this in the literature. And it was much more rich for me. Okay. So just saying this, when we start doing our data analysis and you got that design with the goal in mind, you do want to have a goal because you got to convince people and you want to talk to them about things and you want to persuade them in a certain way, but make sure that you are persuading them ethically and that you do believe in the findings you have. Okay. So a lot of times when I think about the visualizations that I create, I want to know who is going to be viewing these, how much knowledge do they already have, how much time should I spend in preparing the foundation so the person can interpret and look at the visualizations and understand the decisions we made, okay? And then I want to think about what are the decisions that you want the decision makers to make. So let's say, for example, going back to my public health, the provider availability, I want to increase visiting nurse association. I feel very good about that. I think I have data to to support that. I feel like I've done enough good checking on the other side to all the arguments against that. And I think I've answered those well. So now how do I put this decision together to help the decision maker make that decision? And yes, I'm kind of guiding them into that way. But of course, I want to be open to let them have their objections, let them have them talk about it, and make sure that it is something they can come to with themselves. And there's a little piece here I'll talk about how to persuade the decision maker to persuade themselves. Okay. And I want to also make sure that my data visualization will help them make the decision. Because when we get out of the stories and we get away from the spreadsheet and we're creating the story and we've got the visualizations, I want to make sure it's good, it's ethical, it's honest. And I want people to draw the conclusions from it that, of course, I want them to kind of make the decision I want to, but I want to make sure it's a good, honest conclusion they're bringing from it. Okay. As you can tell, I'm very big on data ethics. So quick foundational step here. How many, it's going to be fun. I'm going to do another poll. How many of you have heard of the term cognitive low capacity theory? Give me a Y if you have, give me an N if you haven't. Okay, yeah, I'm not surprised. It is more of a training term. It's a neuroscience term. And basically, think about how you get through the day. So you have all kinds of information coming to you, right? Through your eyes, your nose, your ears, all this information coming into your mind. And it's in your sensory memory. And the sensory memory, it doesn't retain as much. I mean, it's enough to see what, if you're driving down the road, here's where other cars are, here where they are in place with me. Here's where I'm going. Well, here's what the weather's like, that kind of stuff. But you don't want to retain that information. So you kind of almost forget it as quickly as you see it. All right. So you get a lot of sensory memory coming in. And then you have the working memory. And if you were thinking about the sensory memory, it's kind of like, what's the term here I'm thinking of? Bottleneck, exactly. So you got a wide open sensory memory. And then it comes to the working memory. And according to a famous study by Bell Labs, when they were working on the telephone, this is why telephone numbers are 7 numbers, except for the area code. This is why they're that big, because Bell Labs found with their research that people can keep in their short-term memory 5 plus or minus 2 numbers. So that's why back in the old days when we didn't have this, well, I'm dating myself here, but when we didn't have the smartphones and all that, and we had to basically remember our telephone numbers or write them down. And you go to the telephone on the wall. And I love when I go to my college classes and I'm telling students about the phone on the wall and the long extension cord. It's just funny seeing the looks on their faces. But anyway, this is why most phone numbers, you have the memory, you have the area code memorized pretty much, but that's why they're 7 digits, because the working memory can hold 7 chunks of information. Now, the fascinating thing is that we say 7 chunks. As you get more attuned to things, and as you get more familiar with something, your chunks can grow. So it's not just 7 digits anymore. Now it could be like, the common, and I know in the area I live in Winchester was so small, most numbers started with 744 or 745. So I just had to remember that one chunk of information. And then the last 4 digits, I had the 4. So it's actually going down to 5, okay? And if any of you all play chess, think about it this way. When you're a chess beginner, you try to remember all the moves and all this stuff. As you become more proficient in chess, you start chunking together patterns on the chessboard, so you don't have to know all the moves and such. You can just look at a chessboard and see the patterns, and you still have the 7 chunks you're working with in the working memory. It's just that the chunk itself may be much bigger. So this is why when they've done brain studies and you have people that are chess amateurs, their brain's lighting up like crazy because they're trying to keep the working memory and they got all these things they're trying to remember. Whereas when they become much more skilled at it, like a grandmaster, they're not lighting up as much on their brain because they're just remembering board positions and chunks of things they have. They can have maybe the middle game or something like that. I mean, they can remember moves up to 3 or 4 different big patterns. And that's how the working memory works with them. So with the working memory, when we start doing our persuasion, we start doing our data, a lot of folks come in and they want to throw a lot of data at you and they want to throw a lot of stuff at you. And you got to think about, with the working memory, what can I do to get the most important parts of my data into people's minds? And the best way is to put an emotional tag to it. And that's where we do the encoding and retrieval. And that's where it goes into long-term memory. So, for example, on our physician provider availability, one of the things you can do is you can give a lot of data about that. And then you can tell a very telling story about how this one community had had lost lots of people due to heart attacks or cardiac disease or strokes, where you all may have heard the golden hour, with strokes and heart disease, where if you can get to someone in an hour or so, their chances of survival just increase rapidly. And in this case here, you can talk about how the provider availability was so bad that many people weren't able to meet that hour, that golden hour, and you lost a lot more folks because of, something had been preventable if you had just gotten to the doctor maybe 10 minutes earlier or 15 minutes earlier. So there's the emotional tag for that. So want to just do a quick check. Does that make sense? See how that's going? And I want you to think about some of the presentations you've done now, or some of the stuff you've done where you've talked to the public, and how you can kind of now do it in a way that, am I overwhelming them with information? Should I kind of cut back on some of the information, even though it's great stuff? And how can I make the information more emotionally memorable to people? Okay. All right, great. So I'm going to talk a little bit here about brain-friendly presentation principles. And I have actually several classes on this that I do, about a couple of lectures. And one thing that really kind of hurts us sometimes is PowerPoint makes things so easy to do and so easy to create. And this is why when I teach students PowerPoint, I have them turn it off for the first 2 sessions, and they won't use PowerPoint. We sit down and we think about it, and we sketch out, and we kind of storyboard our presentation. Then we get into PowerPoint, because a lot of times people come in and they just dump their ideas into PowerPoint, do a little refinement, then they run off. Okay. So there's no signposting, which is something I've shown you here. You've seen these little blocks here, and I say, okay, now part 2, part 3, something my people can, people can follow with, and some other things you've probably seen. And in a moment here, I'm going to have a chance, and you guys get to interact with this. I'm going to show you a bad presentation, and I want you to tell me why it's bad. Okay. But one of the things we look for is less is more. With PowerPoint and Excel, you can do amazingly fun, creative graphics, and I bet you all have done that, and it's really cool. But you get a lot of this chart junk on there, and the actual message you're trying to get out gets lost. And then sometimes we get so hung up, our PowerPoint presentations don't have as much of an emotional impact because we're not really following the story structure, the and, but, therefore. And we're not making the connections clear. And a lot of times, too, with people is they throw the PowerPoint up, and that's not the presentation. You are the presentation. PowerPoint isn't. And one sin, and I hope no one ever does this, I know no one in this audience does this, is people reading to you from the PowerPoint, line by line. When I was in the patent and trademark office, I trained our attorneys. I used something I called advanced presentation techniques, and I had to break a lot of them of the habit of reading from their PowerPoint slides. First, they would slap up legal text, large blocks of legal text. Then they want to read it to you. Okay. And it's just, you've killed your audience right there. So keep the PowerPoint as less as you can. I know there's a little bit more words on here than I would ordinarily put, but I know you'll get a copy of this afterwards, and I want you to use this as a reference for yourself. Okay. So that's why I put a little bit more for you to kind of help trigger your memory. So let's have some fun here. And one quick thing, just talking about accessible presentation principles. And again, forgive me, I come from the federal government. This is drilled into my head about Section 508, but this is some good tools out there. If you go to section508.gov, they have amazing tools and ideas and classes on how to create an accessible PowerPoint, so that people just don't have, they're not losing the message, and they don't understand what you're saying, because, you've created a nice accessible PowerPoint for them, or some kind of document for them, so that just because they have a disability doesn't mean they can't get the same information. It's vitally good. And yes, thank you for putting that in there. So it's section508.gov training. And I use this all the time. And now all the tools most of the tools, I'll say it this way. Most of the tools have nice built-in accessibility checker tools. Personal opinion, don't quote me on this, but really with Adobe, sometimes I think they really need to update some of their accessibility checker tools. PowerPoint's getting better, but it's always a good idea. Maybe use that for the first pass, but then have someone else work with you on that. When I was at Patent and Trademark Office, Enterprise Training Division, we had a wonderful gentleman who was blind, and he was the person I would go to check things out on visual. And he was wonderful with that. And the good thing is he had the Section 508 training too, and he understood what I was going for. And he also knew storytelling and training and instructional system design. so he could see what my goals were and help me achieve those better. All right. So real quick thing here about right visualization types. I'm a big believer, and I teach my students this. Don't go to something that's exotic. Go to some of the standards there, comparing values, column, bar, line, scatter plots, pie. You can see how all these different work here because you have an exotic chart type. And what's an exotic chart type? Have anyone seen a radar map? It's kind of like a circle, and you got 10, 20, 30, 40 kind of builds out, and lines go to it. And it can be a little bit, what are you trying to show me here? And the audience will do that. So sometimes it may take a little bit. Let me just show you how to read one of these and interpret one of these, okay? So another one that a lot of people like to use lately, I know in some investing, heat maps. And if you've heard of the term heat map, you know exactly what I'm looking for. But basically, it's a bunch of boxes. And depending on the relative size, it's how much they account in, as components in a theory that you have. So, for example, in the investing world, I can have a heat map of a company like GE, General Electric, and then all the different divisions are in that heat map, and how big their box is and where they are in relation to each other tells me how much weight that component has in that overall stock price. And see, even explaining that takes a little bit of time, and you still got to kind of work with your audience. So try to keep with something that people see a lot of. All right, so here we are. This is the interactive part, folks. So take a look at the chart here on the left, diabetes and obesity. This was taken for diabetes care. I can get the full site if anyone's interested in that, but this is one I like to use here. And in the chat, I'm going to be quiet here for a second, but I want you to tell me, what is this chart trying to say to you? And is it doing a good job? So I'm going to take a moment, drink something. You guys tell me what you think in the chat. Left y-axis isn't labeled, right side is, okay. Trend, right? And the chart is trying to say with increased body weight, we have increased incidence of diabetes. Yeah. And if I can ask, Katie, if you want to tell me, did it take a little bit of time to figure it out? It's not terrible, but yes, it's trying to show a relationship. Weight goes up, diabetes goes up, but that's what it says. Is the left side the AC1? It is. And that's what kind of confuses a lot of folks. Left A1C, exactly, right. So I'm going to throw out here what I think is the matter with it and see if some of you agree. So good comments on this. So we're mixing two measures in a y-axis. Here we have A1C, and it's in kilograms. Yes, okay. And the reason why it's in kilograms, it's a medical journal, JAMA, Journal of American Medical Association, if I remember that correctly, in diabetes care. Okay. I like the way you said it. I can see the progression by year with kilograms, which must be weight. I really don't have a clue what it is. Tell me, and the yellow arrows point up, point down, or backwards. Yeah, which direction are they going in? Actually, they're supposed to be pyramids, but some people interpret them as arrows, okay? Now, I will give the folks, y-axis should start with O. That's a key point. If you ever read the book How to Lie with Statistics, that's a point right there. And blue background clashes with colors. And this is very important for folks. You may have people that have color blindness or have low vision. Okay, for example, I have a blue-green color blindness. So sometimes when people throw blue and green, I'm not seeing the distinction. Someone says, I think there's missing info. Could be. We don't know. I mean, take a look at that. It kind of might be there. No grid lines. I do like the fact it doesn't have grid lines because sometimes grid lines can get in the way. I've seen people with the major grid lines, minor grid lines. It looks like it's a big, just a big mess there. All right. Dated info, 1990. Yes, that's me. I just love this chart so much. I use it year after year, and I think I've been using this thing for 10 years. Sorry. I'll try to get a more up-to-date chart. But yeah, okay. Now, I mean, there is one good practice. I like the fact that, you have the color lines, but if you have this in black and white, or, someone can't see color, you have the pyramid and the square or the diamond, right? So that kind of helps distinguish between the lines. Is there anything else anything else you want to do with the chart? And one thing, this is what I tell my students, is this chart is also an example of trying to cram too much information into one chart. This would have probably been better if it was two charts. Get rid of A1C. But I see the person's trying to draw a relation. Could they have used a different chart type? Yes. Diamonds and triangles don't match up. Yes. And that can confuse some folks, or that could cause some questions there. And I like that. You're explaining two things with one chart. I think what the person was doing when I read the article, they were trying to show how, as the obesity epidemic it goes, so does diabetes. And, they both have kind of a correlation there. And one of the things you got to watch out with correlations too with these kind of charts, and this is one of my favorite examples. There's a great website, Correlation Doesn't Equal Causation. And my favorite example from that is the more Nicolas Cage films we have in a year, the more swimming pool accidents. So and it's a strong correlation. Now, what does that mean? Is Nicolas Cage causing swimming pool accidents? Or, as the movies, we're watching him at pools and we fall in because we're so astonished at his acting? I mean, what's going on there, right? So sometimes when you do stuff like this, you also have to make sure you're not confusing correlation with causation. That's a little tangent there, but I like to kind of bring it in sometimes. So that was a lot of fun. So let's take a look at some charts for you guys that I got that Brandon was very kind to send to me. And this one comes from Sidewalk. I'm trying to remember the exact name there, Brandon. Maybe you can pop it in the chat for me. But the Sidewalk one here. So this is Nebraska provider ratios. And this is the idea of how many primary care physicians do you have per person, or how many people per one primary care physician, how many people per primary care nurse practitioner, for mental health provider, dentist. So when I look at this is kind of, okay, this is interesting statistics. What are you trying to communicate with me? What are you trying to say to me? So one thing is I've got some data. It's kind of like you slap the spreadsheet, a little bit better than a spreadsheet on the screen, but what are you trying to say to me about this? What does it matter? And one thing I'd like to see is actually what is the ideal number of people per primary care physician? Because maybe 996 people per one is okay. Maybe it's drastically too many people per one. I don't know. I need a baseline. I need something to work with there. Okay. Now, next one I'm going to let you have. So take a look at this. This is a map and chart. So it's a kind of an exotic chart type, I would say. It's a map. And you can see the colors here. Now, the gradations are good. I like that. What is this data trying to tell me? And throw that in the chat if you want to. Well, one thing that springs to mind, okay, concentration of PCP, exactly right. So it looks like in the bigger cities in Nebraska, you can have, or is this Nebraska? Where is this from? I think it is. Some areas have more PCP than the others. Okay, great. What does that actually mean? I mean, I have some areas here that are blank. There's no color. Does that mean they have no primary care physicians? That the nearest one for these three here is right there, and it's Ashland? Okay. And Weeping Water is kind of there. Basically, what I'm saying is, what is the context? What is it you're measuring for? And what should I be concerned about? Because, and when you take a look at the numbers here, okay, very, very interesting. So primary care physician ratio, that really is not a ratio for me, okay? Exactly. What do you mean by PC? Exactly. And again, as an audience member, and this is a good thing, guys, I'm not public health. So I'm coming to this from the outside looking in, and I'm trying to understand, is there something I should be concerned with here? Is there a problem? I mean, it looks like the upper part of the state looks okay. Looks like they got lots of folks, but I can't really interpret it from that. Let's throw another one. Health coverage, insurance coverage, uninsured per civilian, non-institutionalized capita. Okay, throwing a lot of terms at me. And then we got these percentages. Okay, again, what is the concern? What is it that I need to know? What is it? If I'm a decision maker and I want to give you more funding, and you're asking more funding for Ashland because they have, a lighter shade there, or I'm not even sure what this area is. Should I be sending more money there, or should I be doing something else? Okay. See what I mean by this? And I know some of you may say, oh, this is kind of unfair because they got a lot of charts and they got a lot of documentation around it. That's true. There may be some explanation in the text and documents, but I'm going to tell you something as a presentations expert. People pay a lot more attention to your visuals than they do your text, especially when you're up there presenting, okay? So I'm going to look at this and I'm going to start walking around with my eyes and trying to figure out what this means. And I see we're going up on time. One more, and this one I just thought was great. High health insurance coverage, uninsured per civilian, non-institutionalized capita. Really like to have an explanation for that. High blood pressure among adults. If I'm reading this correctly, and I'm not sure if I'm reading this diamond correctly, the fewer folks that have health insurance, the more there's going to be high blood pressure. I think this is what that means. But I would say, is there any way I can make this more clear? And then this fellow's sitting out here somewhere, not sure what that means. Okay. So I just wanted to bring up there, not to pick on you guys, but to let you look at some examples from what you do in public health and have you think about, how can I make this story more compelling? What can I do with this? Okay. Very good. Population versus heat. Okay. So talking about PCP concentration, not evenly distributed. Great point. Now what do I do with that point? Okay. And let me go here with the decision makers persuade themselves. And this is where you're going to be coming in with the stuff. And this is why it's important. Your audience, you got to establish there's a problem. So you present the data analysis up to a point, and then the decision maker, they can be someone senior, they can be someone in your audience, they could be a patient, they could be the public. You want them to discover the gap. So you want to kind of show them the data analysis, take them up to a point, and then let them try to discover the gap, and then be patient with this. It may take a bit of time, but you want people to kind of come to the conclusion themselves, because what you're trying to do is create buy-in, especially for you folks in public health. You want to not come on as a all know-it-all expert, and you got all the answers and stuff, and just listen to me and do what I say. It's more like, here's what we're seeing here, like with the mask, trying to get people to wear a mask. Ask questions about it, offer answers. All these ideas here to basically have people come and help you complete that thought. And once they have to complete that thought, now they have buy-in, because now they're becoming part of the solution. And they're helping you build that solution, and they're more likely to enlist in that. So, golden question again. If you don't get anything else out of this this presentation other than CCARI, the golden question is: what would you do if you were me? Listen closely to the person, repeat back what you heard to ensure they heard correctly, and then make sure that the solution you give does fit the problem, and it may be the solution that you guys brainstorm together and then implement, because they have the buy-in now because they helped create it. All right, so. Wanted to stop at that and just thank you all very much. And I want to open it up for questions. And, and you've been great in the chat here too. And I hope this has been very helpful. So this is taking a look at the data science from persuasion side. You got the data analytics written down. It's just more about how do I communicate it effectively so I can persuade people. Okay, so we'll go ahead and take some questions here, Brandon.
Yeah, while we wait to get questions in the chat, please feel free to put those there. I'm just going to quickly give some information while we wait for those, and just mention that our next webinar series is on advancing health equity through data visualization on August 22nd for session 3. We hope that anyone that is attending today will be able to be sent that information. Registration link is in the chat as well. The recording for today's presentation and slides will be made available on our website afterwards, and I will also plan on sending those out to folks as well. So with that, going to see if there are any questions from the audience in regards to this presentation.
Bill, I don't see any questions quite yet, but while folks are thinking about things, I had a question, if you don't mind.
Sure.
You talked a lot about learning about the why for the audience. What are people's internal motivations? And a lot of time, public health practitioners are immersed in the communities they serve. Not all the time, but, most of the time.
Right.
Do you have any recommendations for kind of sussing out and getting that information, that knowledge? Like what drives the specific community or population that you're trying to target your messaging towards?
Yeah, I mean, and of course, you'll love the simplistic answer. Just ask them. But sometimes they don't really know themselves, okay? Because they don't understand enough about the issue to ask a good question about it. So sometimes what I do is, when I'm working with this, and like my friend Brad does, is he'll go out and take surveys and polls, and he just kind of get a general baseline of what they think about health. And also kind of like, what is it that's bothering them? What is it that's, having some issues about? With their health, or what are some concerns? Okay. So like with the quarantine, I mean, that's a great example of that, with this whole thing of, I remember, even I asked this, what is this social distancing thing? Why is that important? What is that going to do for me? And, you had a lot of folks that kind of misunderstood that, or, misunderstood the the mask idea. For example, in Kentucky, we have a lot of churches and a lot of folks, there was some prohibitions. They were trying to ban singing. And I remember our church folks were just really upset about that because, that's part of their worship service, the singing. And it was more like understanding, okay, how can we do safe singing? How can we do it so that you can still have the music in your worship, but we can also make sure we don't spread? Okay. And, also work with them because I don't know, I don't sing myself, but as I understand it, singing in a mass was very difficult. So, looking at that and getting people to kind of talk to you and have that dialogue. So that's why with the buy-in stuff is talking to them, asking questions, and getting and reading from what they want, and then helping them help you brainstorm a solution. Okay. Let's see. We were having a disagreement the other day. What is the best way to present decimal points, and how many numbers is too many on a decimal number? Wow. Depends on your audience here. So again, with the general public, I was just doing some research for leadership communication for a book chapter, and my co-author and I were having this actual discussion because they wanted to go to 5, and I said 3 is enough because we're talking about a survey. So, 2 decimal points or 2 numbers after decimal points is well enough to prove our point. So what proves our point and, and makes it easy to remember, okay? That's why when we talk about pi, pi, right? The irrational number, 3.14 is pretty common. That's good. I can remember that. 3.14, whatever, keep going. Yeah, you're going to start losing me. So it's what works with your audience and understanding your audience and the level of precision they need.
Great. Well, thank you, Bill, for your presentation today and for answering the questions to help us better understand how to persuasively use this data visualization, how to use ethos, pathos, and logos. And then we just want to thank everyone for joining today's call in advance. And for those, like I mentioned, we'll be sending out the evaluation here in the next 24 hours. So be on the lookout for that. We appreciate everyone's time and have a great day, everyone.